When you hear you have cancer, you probably in your head or out loud say, no, I don't want this. I didn't ask for this. I did all the right things. I felt so healthy. Make all our own food. We grow organic vegetables. I exercise, I do yoga, I do meditation, self-breast exam since I was 13. I went for my mammograms, and all of a sudden they said there were about possibly 40 tumors, small ones, too many to count. And it didn't all compute. Like, what does that mean? There's too many to count when I feel perfectly healthy.
I've known Maya for years. Our boys go to school together. They've been classmates since 3rd grade, I think, from elementary school to middle school and now high school. And when I saw Maya's pictures, my heart just dropped because I could see right away that there was something really wrong. It's just a precious family, and I knew that this diagnosis was going to be a real challenge for them to navigate as a family.
Getting a cancer diagnosis, I tell everyone, is almost an immediate hard reset on your life. My choices were either give in to the fear and don't do it, and I have 4 little kids and they need a mom, or I talked to some other people who had gone through it. And there was one other mom at school, and she said that I didn't have to be positive all the time. I didn't have to be a warrior, because I don't feel like a warrior. I was scared. She said, what I have to do is pick my medical team and then trust them.
ARA, we really want the best care for patients. We hope to, bring about a patient's best health through imaging and innovation. It's a rapidly changing field, and ARA sets a real high standard for that with everybody who we work with, because we want to be able to do the best by patients, and we expect our community partners to also want to do that with us. And I think together we really do great work in detecting cancer.
So contrast-based imaging, so that's contrast-enhanced mammography and breast MRI, work because they show us the breast tissue in a different way. These pictures show us how the vascular tissue is arranged within the breast itself, and it helps highlight the vascular tissue that may be a breast cancer that could be hiding in the dense tissue. Much more sensitive for breast cancer diagnosis, and they're also more specific.
I think also because I'm a nurse, sometimes we can be more frank with each other, healthcare provider to healthcare provider. They said I needed a biopsy. Then I had breast MRI ordered as well. That was part of the pre-surgical workup. Dr. Ralston read my breast MRI, but read all of my imaging and sat me down and showed me the full spectrum. I mean, that was what made us realize that this probably was more advanced and more high risk, not just stage 1 as we had initially thought, because all of my mammograms prior were normal. You need to know if you're C or D in breast density, and if your lifetime risk assessment is 20 or higher, you need to talk to your doctor about getting contrast-enhanced mammography. You might not have cancer, but if you do, it'll get caught. They'll see it, and you can start treatment earlier.
We do find quite a lot more cancers with the contrast-enhanced mammogram than we do with regular mammography. We currently recommend that patients understand about their breast density and their risk starting at age 25, because they could potentially start screening as soon as 30 years old, depending on what their risk level is. And the other reason we want to know exactly what their density is or what their risk level is so that we can decide, what the best way to screen them is, because we have many different technologies, and we would want to be able to tailor what we're doing for that individual depending on exactly what is best for them.
So it was really gratifying and rewarding to be able to help her, to help Maya navigate the really scary process of a breast cancer diagnosis and treatment. I'm glad I could be there for her. I've continued to be there for her as she's gone through treatment. Asheville is a small town. We run into people all the time. I run into Maya all the time, of course, because our boys go to school together. It was so impactful to be able to help her and then also see that she's doing well on the other side of it, that she's finishing treatment and thriving and still here with us. I'm so glad. I hope I never have to give her bad news again. I hope that she's disease-free and stays disease-free forever.
I listened to what they said, I asked my questions, and then I just showed up. I didn't do it alone though. I had never asked for help before. I don't normally ask for help, but I told my school because they would have to kind of assess my kids if it was affecting them. And so I had a core group of backups. Then all those women who had helped while I was away offered to drive me to my appointments. And it's kind of a unique gift that I thought at first I was asking for help, but really it was such a gift in our friendship. I started hearing people say, find your tribe. And so I told them, like it or not, you guys are my tribe now. Really what I want, what I pray for is that I get to be the mom to my 4 kids for as long as they need me. All of the things I get to do as a mom, I no longer take for granted. When I'm outside and I'm gardening and I'm planting and we're looking at the mountains, hiking, I'm always like, take this all in. It's so beautiful, because you could wake up one day and not be able to see any of it anymore.